So, what is resilience-informed therapy? Here we are emphasizing our inherent capacity to heal from trauma when we have sufficient access to resources and support. And this approach to the work recognizes that every human being has an intrinsic drive toward wholeness once we have sufficient resources and supports in place. Now, as you can probably tell from the photographs that I take and that I share with you here, that so much of my work is really drawing upon what we see in nature. And that, in a sense, when we have a plant that's growing that has sufficient nutrients in the soil, when we have sufficient access to water and light, that we'll see that plant thrive. And we must house that each person that we serve, and truly all people, including ourselves, we thrive because of the environments that support us. And so we can't take a person and remove them from that environment and just look at what's happening inside the person to deem the state of health or illness. We have to really understand that we are part of systems, and that those systems that surround us have a very significant impact on who we are and who we become. I mentioned this at the very beginning of this module, so I won't go into great detail here, but I will remind you once again that this is an integrative approach to care that draws from a pretty wide-ranging set of therapies that are housing the importance of relationship and that social cultural settings and context that we live in, that we are looking at this through a neurobiological lens. We are looking at this through the humanistic and positive psychology lenses. We're incorporating mind-body therapies. We are incorporating parts work therapies. And we have somatic psychology or body-based psychotherapies in here, and narrative exposure and EMDR therapies. When I speak about an integrative approach to therapy, I want to differentiate this from eclecticism. Eclecticism pulls in a vast array of techniques, but they can feel disjointed or confusing to the client. But an integrative model of treatment focuses on the common factors that underlie the efficacy of all psychotherapies. And as you'll see, that we're also adding in an arc to treatment that's going to be based on Judith Herman's phasic model to care. And I'll teach you how we integrate these different modalities within that phase-based approach so that it feels really congruent and coherent to our clients and to ourselves. Basically, you'll come away knowing, what do I want to apply and when do I want to apply it? And why does this make sense for my client right now at this stage of treatment? So when we speak about the common factors versus specific ingredients in psychotherapies, we can really look at those common factors being the importance of the therapeutic alliance and rapport, working collaboratively with your clients so that you're a team together, that you're co-pilots in their care, and that means that your client can give you feedback about what's working for them and what might be isn't working. You have with your clients agreed upon goals, right? So that no matter what modality you're working from, these are the factors that make that modality work. It's the empathy that we come with as therapists. It's your own congruence and genuineness. Our willingness to be culturally sensitive and to adapt our interventions to meet and match the cultural background of the people that we're working with so that it feels relevant to them. And that, of course, the one factor that is very much out of our realm of control is whether or not our clients are willing to engage with treatment. But when clients engage with treatment, that improves the outcomes, of course. Now, the specific ingredients are those specific elements of a psychotherapy that are unique to that modality. For example, certain therapeutic approaches will integrate that challenging of an ineffective belief or taking a look at it and refining it. Other psychotherapies focus on the expression of difficult feelings and that emotional release. Some psychotherapies focus on cultivating mindfulness and body awareness. Some more on self-compassion. Some therapies focus on the improvement of interpersonal relationships and developing those skills. And others are about making lifestyle changes. You'll see some of these specific ingredients woven into this integrative model, but all of the common factors form the foundation for efficacy, and hopefully our clients are willing to engage with us. What I will say is that when we work in a collaborative approach to care, where our clients feel comfortable telling us what works and what doesn't work, your client feels comfortable saying, no, I didn't like that you said that, because they feel safe enough with you, that therapeutic alliance is strong, we're going to see a greater likelihood that clients will stay with and stick with therapy. So the principles of the resilience-informed therapy approach is that this comes from a strength-based orientation. We're going to focus on what are the existing strengths, and we're going to help them grow. We have a phase-based model of care, and there's beautiful, very current research on the efficacy of phase-based approaches to trauma recovery. We have a mindful and embodied emphasis in this work, and you'll get a greater sense of that as we go along, but lots of opportunities to be curious about your experience in the present moment, because that's what mindfulness really brings us. It's about the willingness to bear witness, to observe your experience, to be non-judgmental about your experience, and to be curious about what is your present moment experience. It lives here, present moment, here and now. And embodiment is such a key element to this. One of my mentors, Christine Caldwell, challenges the concept of mindfulness and offers this alternate term that we're really speaking about, bodyfulness. That most mindfulness-based approaches are actually building more somatic awareness. And so the embodied approach here allows us to also be with the felt sensations and emotions in the here and now. Our minds can project into the future, can ruminate about the past, but our bodies live in the present moment. We go towards an emphasis on connection and co-regulation. We'll define co-regulation in a future module, but for now, what I'll say is that this recognition that we are mutually influencing each other, there's a reciprocity and a way in which when I'm working with another person, they're going to shape me, and likewise, I'm going to shape them. And that it's through that willingness to receive the experience of the other and hopefully creating a safe enough environment where they can receive your influence, a positive influence, that allows us to regulate the experience. When you are in a calm and safe and compassionate nervous system state and mindset and emotional state, you're able to, in some way or another, kind of transmit that to the other. So co-regulation invites someone else, in a sense, to be supported by, be held by your compassion, your curiosity, your emotional and cognitive flexibility. We'll come back to that topic later. The next principle of resilience-informed therapy is cultural humility, sensitivity, and inclusiveness. Even though we get trained in this field to have a tremendous amount of expertise, when we actually show up in the room with another person, we also have to learn how to suspend our expert hat, right? Take that off temporarily so that we can receive the other person and their worldview and be be welcoming of that, right? It's not for me to assert my worldview and make that a shared experience. It's actually to receive the worldview of another person and to allow myself to recognize the importance, the value. If I come forward with respect and dignity to dignify another person, right? That is such an incredible gift. It's an incredible way that we say, wow, not only do I come in with something that I have to share, but I'm going to let myself be changed by you. You are going to influence how I see the world. And when we receive each other at that level, it communicates to another person, you are important. You had an impact on me. You had import. I received something from you just as much as I gave something to you. So now we've got that reciprocal exchange once again. And as you can tell, this work is person-centered and is offering compassionate care to the people that we serve. All of this is rooted in a biopsychosocial model of care. The biopsychosocial approach considers biological, psychological, social, and cultural factors and their complex interactions in how this impacts our health, our illnesses, and our healthcare delivery. It's all a very kind of fancy terminology here, but what this stands in contrast to is the biomedical approach to care and the way that psychotherapy has been medicalized and in a sense has been protocolized. And all of a sudden we're adhering to a protocol, we're adhering to notes, we're adhering to insurance companies rather than prioritizing the person in front of you. And so the biopsychosocial approach pulls us out of that medical model into this collaborative relationship with a person and then allows this to be person-centered rather than protocol-centered. This will become profoundly relevant when we speak about something like EMDR therapy, where we receive these protocols of care. But we need to ensure that we work in an integrative manner where we're not so wedded to protocol that we actually lose sight of who's sitting right there and what do they really need. When we're treating trauma, the invitation is to increase your client's capacity to stay present with and effectively respond to their own states of mind, their own emotions and sensations, the interpersonal exchanges, and the degree of complexity that lives within them and around us. So you'll hear me say a lot that the goals of therapy aren't necessarily to eliminate that hard memory or desensitize or make any part of them go away. Actually, what we want to do is just become more human and more kind to ourselves and the people around us, more aware of those habitual places that we go mentally, emotionally, and have more choice so that we can be of better service to ourselves and also to the world around us. In our resilience-informed approach, you are helping your clients develop greater tolerance for uncertainty, ambiguity, the inevitable experiences of disappointment and loss, conflict and compromise. Difference, right? You're going to believe one thing, I might believe something different, but how can we stay in connection? The fact that you inside of yourself might have competing needs and desires, the need for closeness and the need for separateness. You might have conflicting ideas and emotions. Sometimes you might be so angry, even feel hateful towards the same person that you also love. And it's this slide, it's this set of capacities that really leads me to feel that trauma work is world work. Resilience work is world work. If our world leaders were better at this, uncertainty, ambiguity, conflict, compromise, difference, conflicting ideas, how might this world be different?